the data with infectious disease expert Dr. Edsel Salvaña. He joins us now on The Final Word. Doctor, thank you so much for joining us. Why are you saying there is a mutation in this novel coronavirus that is at least 3 times more infectious? Doctor, can you hear me?
There's no audio.
There's no audio.
I can't hear anything.
Are you?
Hello? There.
Okay.
There you go.
Can you hear me now, Doctor?
Yes, I can.
We were muted. We were muted
Yes.
there for a while. Okay, so why are you saying, Doctor, that there is a mutation in this novel coronavirus which is making it 3 times to 9 times more infectious?
Right. So there was a paper in the journal Cell that came out a couple of days ago, which actually showed that this mutation in the spike protein of the virus, the spike protein is what it uses to infect cells. There is a D614G mutation in this strain, is what we will call it, and it seems to confer increased infectiousness in the virus. There were 2 pieces of evidence that they cited for this. First is that in Europe, from the original strain of the virus, now about 90% of what's going on in Europe is now from this new strain. So it's actually replaced the old strain of the virus. So
is this new strain more dangerous, Dr. Salvaña? Is this new strain more dangerous?
No, it doesn't seem to be more deadly. It's just more infectious. And then there was a second piece of evidence where they used parts of this virus in the laboratory and fused it with other viruses, and it seemed to confer increased infectiousness in mice. So aside from real-world data, where you're seeing that this virus is taking over from the old virus, there's also laboratory evidence that this virus seems to be more infectious.
So is there already evidence, Dr. Salvaña, that this mutation or this new strain is in the Philippines?
Yeah, so we're waiting for some of the sequences. These are happening already. People at the Philippine Genome Center in UP are looking at these mutations. But so far, the only publicly available sequence we have are from March, and it did not show that mutation yet. But for the ones in April, May, and June, we need to take a look at those. But just based on the behavior of the increase in cases, I would say that it's probably here in the Philippines. We've seen it in Taiwan, in Australia, and in Japan as well.
But could this increase in cases, more than 2,000 on Sunday and more than 2,000 yet again today, is due to the increase in testing and not because of this mutation?
Well, it's part of that, but it's also, it seems like the surge is real. Even some of it is also backlogged. So, it's not really as big a spike. It is a gradual increase, but it's a definite increase. I don't think anybody would dispute the increase. And that increase can be from increased testing. It can be from opening up gradually. But we have to think about the fact that a more infectious virus can be driving this as well. Because in terms of what's happening in the rest of the world, it would be strange if it wasn't happening here as well.
So, Doctor, when are we going to get a confirmation if this mutation or this strain is indeed in our country? How long will we have to wait?
Well, we just have to take a look at the sequences that we already have. It only takes about 48 to 72 hours to sequence a virus. We just need to take a look at the data. It's not rocket science, We can analyze the genome and figure out if it's there. But it wouldn't really change anything at this point, because the most important thing is that we're seeing the cases go up. Then we have to double our effort to use masks, to do physical distancing. These are things that we know with evidence can interrupt the transmission of the virus.
And of course, at the end of June, we saw presidential spokesman Harry Roque cheering that we beat the UP forecast of 40,000. But since then, we have been haunted by soaring numbers, as we have seen over the past week. It's now 46,000, Dr. Salvaña. So with the 60,000 that a UP group has come up till the end of July, is this now an too optimistic number?
Yeah, it's difficult to predict what's going to happen because we know what works in terms of trying to interrupt transmission, and I really hope that everybody does their part. Government also has to ramp up the programs that we're doing, and so we all have to work together so that we can decrease the number of cases. This virus is out there; it's now more infectious. We're really going to see more cases, but the most important thing is that we are able to manage the numbers so that they don't overwhelm our healthcare system, because that's when we see people who unnecessarily die, because if they can't get into the hospital to get care when they have severe or critical disease, then they're just going to die rather than us being able to save them, because coronavirus, if properly managed, is survivable.
Thank you so much for your insights and for joining us on The Final Word, infectious disease expert Dr. Edsel Salvaña.
Thank you.